Good day everyone, I'm Merges Asmetante from BSN 1A17. So for today, I'm going to perform a return demonstration in assessing the neurologic, musculoskeletal, and peripheral vascular system. Prior to performing the procedure, I'm going to of course perform comprehensively to deter the spread of microorganisms and to prevent cross-contamination. After that, we can proceed with the assessment. So good day. I am Jones and I will be your nurse for today. Can you please state your name?
I'm John Lucio Esmitante.
And your date of birth?
I was born on May 4, 2004.
Okay. So that would be the first step. You have to verify your patient's identity to ensure that we have the correct patient in front of you. And if there are any curtains or door, you have to close it to provide patient privacy. After that, we can now proceed and explain the procedure and its purposes to the patient. So how do you want me to call you?
Just call me John.
Okay, John. So for today, I'm going to assess your mental status, cranial nerves, reflexes, and motor and sensory function. So is that okay with you? So this is important to ensure that everything is normal, and if there are any abnormalities, I'm going to take note of it to prevent any further complications. So in order to do this, I will be needing your cooperation para maging accurate yung assessment natin for today. So is that okay with you?
Okay.
Okay. So do you have any questions before we begin?
No?
Okay. But if you do have, you can just ask me throughout the assessment. So gusto mo bang mag-CR muna bago tayo mag-start? Okay. So I'm going to begin in examining the overall hygiene and physical appearance of my patient. So as I am assessing, my patient is 17-year-old Asian male, appears with age, and he appears healthy, well-groomed, and disheveled. After that, I'm now going to assess the neurovascular system. Okay. Assessment of mental status. First, evaluate the patient's orientation. So, pwede niyo po bang i-state yung pangalan niyo?
Ang pangalan ko po ay Neurologic Esmitante.
Saan po tayo ngayon?
Narito po tayo sa hospital.
Tapos, ano po yung petsa ngayon at yung time po?
Ang araw ngayon at petsa ay April 24, 2022 at ang oras po natin ngayon ay alas 2 ng hapon.
Okay. So, saan po kayo nakatira dyan?
Nakatira po ako sa Surigao del Norte,
Saan po sa Surigao del Norte?
Municipality of Davao.
Okay. So, gaano na katagal ang nararamdaman niyo po?
3 days na po.
Okay. May mga times mo ba na nahihirapan kayong alalahanin yung mga nangyayari sa inyo at yung sa paligid niyo po?
Wala po.
Okay. Next, evaluate level of consciousness using the Glasgow comma, which assesses the eye, motor, and verbal responses. So yung eyes, it looks spontaneous, so it's 4. Pwede na po bang itaas yung right arm niyo po at yung left arm niyo po? Baba po. Okay, so it seems like the motor response in verbal command, and that is 6. That will be graded 6. Ngayon naman po is i-test ko yung verbal response nyo. Okay, so bakit po kayo napalito sa hospital?
Meron po akong abdominal pain.
Okay, so sino naman po yung kasama niyong pumunta dito?
Ako lang po pumunta rito nag-iisa.
Okay, so how about sa ice cream? Anong flavor yung favorite niyo?
Buko salad.
Okay, good. So it seems like the verbal response is oriented and converse, and that is graded as 5. Assess memory, beginning with immediate recall. May sasabihin po ako sa inyo and then i-repeat niyo po, okay?
Okay.
7, 4, 3.
7, 4, 3.
Then sabihin niyo po, papaliktad.
3, 4, 7.
Okay. So how about 7, 4, 3, 5, 7?
7, 4, 3, 5, 7.
Then papaliktad naman po.
7, 5, 3, 4, 7.
Next is recent memory. Kanina po, may mga information po akong sinabi sa inyo bago mag-start yung interview. So, naalala niyo po ba yung mga information iyon? Pwede niyo po bang sabihin sa akin?
Opo, naalala pa po yung sinabi mo kanina. Yung temperature ko po ay 36.5 at ang BP ko po ay 120/80 at ang weight ko po ay 52 kilogram.
Okay. Lastly is the remote memory. So, naalala niyo pa po ba yung saan kayo nag-birthday nung last year at yung mga kaganapan?
Opo. Sobrang saya ko po at sinelebrate namin ang aking birthday sa Boulevard ng Tapa at kumain kami ng masarap ng barbecue.
Okay. Assess abstract reasoning. Pwede na po bang i-explain ang ibig sabihin ng proverb na the early bird catches the worm?
Ang ibig sabihin nito po ay kung ikaw ang nauuna, mas malaki yung advantage mo at oportunidad kaysa sa iba.
Ability to understand spoken and written word. Pwede niyo po bang i-point yung hair niyo? Okay. How about yung chest niyo po? Okay, good. Tapos, say niyo po yung name niyo.
I'm General Esmitante.
Okay. Ito naman po, basahin niyo po. Tapos, anong ibig sabihin nito?
Well-groomed. Ang ibig sabihin nito po ay maayos na panamantay.
Test for cranial nerve functions. Cranial nerve number 1 are olfactory. I-clear niyo po muna yung nose niyo.
Okay.
Very good. Then, i-close na po niyo yung eyes niyo. Tapos, may ipapaamoy po ako sa inyo. Then, i-identify niyo po kung ano iyon.
Okay.
Takpan niyo po muna yung isang butas ng ilong niyo po. Okay. Amoyin niyo po. Ano po ito?
Kape.
Okay, good. At sa kabilang ilong naman po. Ano po ito?
Peanut butter.
Okay, good. Cranial nerve number 2 or optic. Here we are going to test for visual acuity.
E. F. P. T. O. Z. L. P. E. D. P. E. C. F. D. E. D. F. C. Z. P. F. E. L. O. P. Z. D. D. E. F. P. O. T. E. C.
Then sa left eye niyo naman po. Okay.
E. F. P. T. O. Z. L. P. E. D. P. E. C. F. D. E. D. F. Z. Z. P. F. E. L. O. P. Z. D. D. E. F. P. O. T. E. C.
Okay, then basahin niyo po both eyes.
E. F. P. T. O. Z. L. P. E. D. E. E. C.
Ask the patient to read a paragraph or sentence to assess near vision.
John Rollo Esmitante, grade 11, Rutherford, Basic Calculus, Direction. Choose any topic from Module 1 to 9, create a prior model.
Next, assess the visual fields of each eye for
So,
confrontation.
dyan gagamitin niyo po ito sa pag-cover sa right eye niyo po. And then po sabihin niyo yes kung nakita niyo po ito sa peripheral view niyo po, okay?
Okay. Yes. 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 Yes.
Okay. Sa left eye niyo naman po.
Yes. 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 Yes.
Cranial nerve number 3 or oculomotor, cranial nerve number 4 or trochlear, and cranial nerve number 6 or abducens. First is inspect margins of the eyelids of each eye. Then assess the cardinal position of gaze. Then assess for the pupillary response to light and accommodation to both eyes.
I-off ko muna po yung lights. Tapos, tingin naman po kayo sa kit ng pen light and then tagos po yung tingin. Then, ulit po sa pen light and tagos po yung tingin. Okay po. Sa pen light and tagos. And then, tagos. Okay. Tapos naman po, i-follow niyo po yung pen light po as I move towards your face. Okay.
Cranial nerve number 5 or trigeminal, beginning with mandibular notch.
Clench your teeth. Okay, good.
Second, maxillary branch.
So, i-close na po yung eyes nyo, tapos i-attach ko po itong safety pins at tip po ng ball pen. Tapos i-identify nyo po if sharp or dull yung nafe-feel nyo. And then, i-identify nyo din po kung asang parte. Okay?
Okay.
So, close po yung eyes nyo.
Dull forehead.
Lastly is ophthalmic branch. You have to test for cornea reflex.
So, next po dyan, i-test ko po yung cornea nyo. Then, tingin po kayo sa malayo. Tapos sa taas po. Tapos sa gilid po. Okay.
Cranial nerve 7 or facial.
Can you please smile? Okay. Frown. Tapos, raise your eyebrows. Then, wrinkled forehead. Tapos, puff out your cheeks. Okay, good.
Cranial nerve 8 or auditory.
Ano po is gagawin natin yung Weber and Denise test. Narinig niyo po ba both sides equally?
Opo. Naririnig ko po. Sisipat.
Okay. Ayun naman po is ang Renee's test. Tapos sabihin niyo pa sa akin kung wala na kayong naririnig ng tunog.
Okay. Wala na po akong naririnig na tanong. Wala na rin po akong naririnig.
Cranial nerve 9 or glossopharyngeal, and cranial nerve 10 or
Can you please say ah? Okay, good. Tapos, I'm going to test also for gag reflex. So, can you please open your mouth? good. Ilalagay ako sa dila mo, tapos i-identify mo kung ano yun, okay? So, can you please close your eyes? Then stick out your tongue.
Ito po ay gatas.
Igalaw niyo po yung dila niyo up and down, tapos side to side. Down, side, side. Okay, good. Tapos inumin niyo po itong water. Okay, good.
Cranial nerve 11 or accessory. First, assess trapezius muscle. Then assess sternomastoid muscle. Inspect the ability of the patient to
i-round
move his
yan
neck.
Okay. Tapos sa chin. Then to the shoulders. Tapos, okay.
Cranial nerve number 12 or hypoglossal. So assess the strength and mobility of the tongue. Ask client to protrude tongue, move it into each side against the resistance of the tongue depressor, then put it in the mouth. Inspect the upper extremities. Observe for skin color, presence of lesion, rashes, and muscle mass. Palpate for presence of lesions, rashes, and presence of masses. Ask the patient to extend arms forward and then rapidly turn palms up and down. Ask the patient to flex upper arm and to resist examiner's opposing force. Inspect and palpate the hands, fingers, wrists, and elbow joints. Palpate the radial and brachial pulses. Have the patient squeeze two of your fingers. Ask the patient to close his eyes, then place a familiar object in the patient's hand and ask him to identify the object.
So, can you please
It's okay.
to the opposite hand?
It's a ball and
Okay. Then to the other hand.
And now, using your finger, trace one digit number on the patient's palm and ask him or her to identify the number. And then repeat on the other hand with a different number.
What's the number?
3,
Okay, to the other hand.
5,
Okay, good.
Assist the patient to a supine position. Examine the lower extremities, then inspect the legs and feet for color, lesion, varicosities, hair growth, nail growth, edema, and muscle mass. As for pitting edema in the pretibial area by pressing fingers into the skin. If an indentation remains in the skin after the fingers have been lifted, pitting edema is present. Palpate for pulse and skin temperature at the posterior tibial, dorsalis pedis, and popliteal areas. Have the patient perform the straight leg test with one leg at a time. Ask the patient to move one leg laterally with the knee straight to test abduction and medially to test adduction of the hips. Ask the patient to raise the thigh against the resistance of your hands. Next, have the patient push outward against the resistance of your hands. Then have the patient pull backward against the resistance of your hands. Then repeat on the opposite side. Assess the patient deep tendon reflex, beginning with biceps reflex. It tests the spinal cord C5 and C6. Next is triceps reflex. It tests the spinal cord level C7 and C8. Next is the brachioradialis reflex. It tests the spinal cord level C3 and C6. Next is patellar reflex. It tests the spinal cord level L2, L3, and L4. Next is Achilles reflex. It tests the spinal cord levels S1 and S2. Lastly is plantar or Babinski's reflex. It is used to determine adequacy of the central nervous system. Ask the patient to dorsiflex and then plantar flex both feet against the opposing resistance. Assessment of motor function. You have to assess the gross motor and balance test, beginning with walking gait. Second is Romberg test. Ask the client to stand erect with arms at the side and feet together. Note any unsteadiness or swaying. Then with the client in the same body position, ask the client to close the eyes for 20 seconds. Again, note any imbalance or swaying. It will be called negative Romberg when the client stands erect with minimal swaying with eyes both open and closed and is able to maintain upright posture and foot stance. Third is standing on one foot with eyes closed. Ask the client to close the eyes and stand on one foot and then the other. Stand close to the client during this test. Maintain stance for at least 5 seconds. Fourth is heel-toe walking or tandem walking. Ask the client to walk a straight line, placing the heel of one foot directly in front of the toes of the other foot. Maintains heel-toe walking along the straight line. Lastly is toe or heel walking. Ask the client to walk several steps on the toes and on the heels. The client should be able to walk several steps on toes.
Now that we are
heels.
done performing all of the procedures, we can now perform proper hand hygiene and then document all the findings of the assessment. And if there are any abnormalities, you have to refer your patient to other healthcare providers for further evaluation. So that would be all. Thank you.